AJMA, as you said, was formed in the wake of October 7th, really by originally a group of physicians who were, guess what, WhatsApping, and talking about two things. One was this volcanic eruption of anti-Semitism in the healthcare space that, as Sherry talked about, was shocking and disturbing and disappointing, especially, and I know many of you share this experience, after they had stood up for all the other groups for years and years. So first they were talking about that. The other thing that people were WhatsApping about was talking about wanting to volunteer in Israel, stand with their Israeli colleagues, connect to the Israeli medical community. So I'd say that AJMA was founded on those two pieces, but certainly the fight against anti-Semitism was prominent. And so a lot of WhatsApping. Within weeks, almost 1,000 healthcare professionals were involved in this. And when the people who started it looked around and said, where's the national organization that represents us? There wasn't one. And many of you took the bull by the horns and formed Jewish ERGs and other organizations. Maybe you had to call it an affinity group, or maybe you had to call it a club or a whatever, but you pulled together something locally because it was so necessary. Both because we have to join together in the fight, so to speak, and also because of what's been happening this morning, which is you just need to be with colleagues that you feel you can trust and feel comfortable with for just a little while, because it's so uncomfortable in your institutions, and we recognize that. So AJMA is your organization, sort of on a national level. We are a professional association. Every single person in this room needs to join AJMA if you're not already a member. We're doing a lot of things sort of at the national level in this fight. We're going to Capitol Hill. We're going, I can talk about it a little later, we're going to professional associations. We get recognized at a different level because we're a national collegial organization. So when AJMA reach out to the AMA or the AAP or whatever your professional association that is causing you trouble, they listen, they open the door, they meet with me, they talk to us, and we have an opportunity to sort of stay in this at the national level. And then we also need lots of members across the country, which is our strength, because it's all of you are the foot soldiers on the ground. You know what's happening in your institution. You know how to leverage that and make it work. Some of these incredibly successful ERGs are doing just that because you know your administration, you know the players, you know what's happening also in your associations, and we need all of those ears to the ground